My name is Jill Arnold, and I am currently the Director of Nursing for Women's and Children's Support at Penn State Health Hampton Medical Center. For this project, I was the nurse manager for the neonatal ICU of the Penn State Children's Hospital. So the title of this project is Leading Engaging Teams Using Stay Interviews to Improve Nursing Retention. So really to introduce this concept, stay interviews are a technique to improve retention and authentic, meaningful relationships with staff. The goal really is to engage with individual staff members to find out why they love working for you and what is making them stay. So the method to this project was dividing out the 150 staff nurses that work for the neonatal ICU across 5 nurse leaders. The goal for this was that each staff person could then meet with different leaders throughout the year. It increased the face time and support with the manager, the assistant nurse manager, and the clinical staff leaders. During the meetings, which were really only 15 to 20 minutes long, we asked 3 kind of targeted questions and then allowed the staff member to drive the rest of the agenda. So the 3 questions that we specifically asked were, kind of as you see on the screen, what's your favorite part of your job? What's that pebble in your shoe? And what would be something that would make you leave? So favorite part of our job, really to start the conversation off with those inspiring, I love doing, fill in the blank. It might be taking care of patients. It might be engaging with families. It might be, I just love my leaders. It could be a variety of things. The pebble in your shoe, what's that a little annoyance that if left unchecked would be really bothersome to you, which is distracting to patient care? What is the one thing we think we could change? And I'll tell you, those things often turned into projects. So staff directed quality improvement projects in the units. And then the third question is, what would be the thing that would make you leave? And really what we're looking for here is, are there themes? Is there something going on that we have to address urgently? This is the smell the smoke before you see the fire. What's happening here? And honestly, many of the staff talked about, if I didn't have a friend at work, if I didn't feel supported, if it no longer felt like I could be giving quality of care. So fortunately, they didn't share anything that were immediate concerns that we had to rectify quickly. However, we took all of these themed ideas to our shared governance council to review then opportunities. So as I share here in the outcomes, what I did was separated family obligations and job dissatisfaction reasons for terminations or turnover compared to professional growth and retirement. We separated professional growth and retirement because those are both really good reasons to transition out of a role, whereas family obligation and dissatisfaction were potentially negative. So as you see, as we started this through the first quarter of 2019, we started out with 4. There was a slight intick in fiscal year 19, then second quarter, but then we had a pretty aggressive decrease then all the way to then second quarter fiscal year 21. So just this past winter where we had no terminations for these 2 specific reasons. So why does this matter? Why is this important to us? So authentic, meaningful, and frequent interactions between leadership and our team members reduces that risk of turnover due to dissatisfaction, because the staff nurse, the staff members have that opportunity to partner with their nurse leaders and really just talk about what matters to them. These weren't formal, conversations that felt kind of very intense and very frustrating for staff. They were fluid, they were engaging. We talked about family, we talked about things that mattered to the staff member because we were creating authentic, meaningful relationships. Several staff members, had really positive things to say, but one sticks out to me. And the staff person said, it's really nice. I've never had a manager that cared about who I was as a person, the things that really mattered to me. And that just stuck so significantly for me. And it really is what kept this project alive, knowing that we really were making impactful differences in our staff members. So My suggestion to you is to continue to consult the literature and put this or something like it into your practice, because exit interviews are really, quite frankly, too late. You've already lost the employee. The stay interview is certainly what's going to keep um, a much better pulse on what's happening with staff. We want to keep them staying. We want them to remember why they want to stay. We want to keep those conversations open. So I look forward to any questions, and thank you for your time.